Hey guys, Dr. Mashburn again, and this should be the last lecture I have to do for 201 for the lab. So if you're watching this, then give yourself a big hand. You have made it through all the labs, and you've made it through 201 online, and I'm very proud of you. So keep up the good work. You're just about done. Today we're just going to finish up the last of the lab information. Again, you have a sheet that looks something like this in Blackboard, so you want to print that out so that you can follow along with the structures that you need to know. This should be a lot of review. If you've already watched the lecture videos on the special senses, then this is just going to kind of retouch some of that information and show you where you would see it on a model, because obviously the model pictures is what I'll use, or diagram pictures for your exam. So just to kind of reiterate how to identify those structures. You've also got the YouTubes, so you can watch those as well, and that will help you study. When we talk about the senses, we have what are called your special senses, and I've included touch as part of your senses, because growing up you heard you have your five senses. You have your touch, taste, smell, sight, and hearing. Well, in reality, the special senses don't include touch. Touch is just a physical receptor. Your special senses have modified receptors. They're kind of modified special endings. There's multiple steps involved in your brain being able to figure out what your special senses are telling you. So your special senses are really taste and smell and sight, hearing, and also equilibrium. So there's actually two special senses inside your ear. But I throw touch in there just to kind of remind you that you do sense your environment, your physical environment, using touch. So let me get this PowerPoint up and running. And this should not take that long to get through. Hang on just a minute. So this first slide is just going to basically remind you what you learned way back in Unit 1 about touch and the way we sense our environment. There's basically three kind of receptors that we use to sense the environment around us. The first one is the Meissner's corpuscle, and that's for fine touch, fine tactile touch. Think about reading Braille. You're only going to find that. Remember, this is thick skin, so this is going to be on your fingers and on your feet, on your hands and on your feet. The second one are the Pacinian, and you have those everywhere, corpuscles. And they're for deep pressure. So when you're sitting down or got your hand on your face in your hand, anytime you can feel deep pressure, that are your Pacinians. And these are just modified nerve endings. When the pressure, basically when you squeeze it, it causes it to fire and you get a response. And then last but not least, there are some little nerve endings that are associated with hair follicles. So if you have a little bug crawling across your body, it wiggles the hair, and that hair causes those little follicles to move and those nerve endings to move, and you feel somebody crawling on your skin. So that's how we sense touch in our environment. And there's a few other things, but that's the only ones you need to know for this test. Those are those three types of touch receptors. Now the first of your your special senses is taste. And you may have also seen the word gustation. And taste uses chemicals to respond, specifically chemoreceptors. And they're located all over your tongue. And basically, this is your tongue, so hopefully you know that that's the tongue, okay? This is the front, this is the anterior side. And you have basically taste buds, which if you go back to your video, you'll see that with Miss Nikki looking at the different taste, different chemical senses. There's a little taste bud, and it's got a little cilia associated with it. I don't have a picture of that, but you've got your diagram in your book of a taste bud. But you also have these little, basically, things on your tongue, these little papilla. And they're associated with taste and taste buds. And you have three kinds. You have the foliate, and then like foliage, like leaves, and they don't show it really well on this particular picture, but you can see them in your textbook. These little folds in your tongue, and if you stick your tongue way out and look, you can actually see them. Then you have what are called fungiform papilla, and fungus like a mushroom. And so these little things look like little mushrooms on your tongue. Those are your fungiform papilla. And then you have what are called the circumvallate. And these are these kind of big ones. So you stick your tongue way out and look on the back of your tongue. You'll see this little pattern of bumps on the back of your tongue. And so that's really all there is to know right now about the taste receptors. For the exam part, we're going to talk to you about the cilia, and you'll have to kind of know that there's chemoreceptors and things like that. Which chemoreceptors are responsible for salt and bitter and sweet. What's specific about those chemoreceptors, how they work. But for the lab part, just be able to identify the circumvallate, foliate, and fungiform papilla on the tongue. The next one is hearing and equilibrium. And so this is an ear, obviously. And when you think about the ear, you kind of divide it into three regions. And you have what's called the outer ear. Got ahead of myself. The middle ear. And the inner ear. And I have basically divided that out for you on your lab guides so that you know which structures go in which part of the ear. So the outer ear basically is the part that you can see that goes all the way in until the tympanic membrane. That's considered your outer ear. Your middle ear is this area right beyond the tympanic membrane that includes this little area through here. It includes your ossicles. So it's kind of this area kind of right inside the bone. And then the inner ear, get rid of this, hang on a second. Your inner ear would be kind of right through there. It includes your cochlea and your vestibule. So I'm going to go over each one of these structures and show you how to identify them. So the outside of your ear is called the pinna or the auricle. So this is the outside of your ear, called the pinnacle. I keep saying that. Pinna or auricle. You have the helix, which that's just kind of a little swirly part inside your ear. Don't worry too much about that. You have the lobule, which is what you can have your ears pierced or hold and wiggle your ear. This is the lobule down here. And then you have your external tongue-tied today. External auditory meatus, or you can also say external auditory canal. You could say external acoustic canal, external acoustic meatus. All those are acceptable, and I'll try to have all those different choices as an answer on your exam. Do me a favor, let's just stick with this one. That'll be the easiest one to grade if we all do the same thing. And that way, if you type in that, it'll be right. So this is basically your ear hole. If you stick your finger in your ear, this is how sound gets from the outside into the inside. So the whole purpose of having this big outside ear is to focus sound, kind of like a satellite dish, in toward the ear canal, the meatus. Alright, so once your sound waves, they come through here, they're going to hit this membrane here called the tympanic membrane. And we call that our eardrum. You've probably heard that before, like a timpani drum, that's where the word comes from. So you have your ear, your tympanic membrane, or your eardrum right here. And then behind that, you have your ossicles. And if you remember, we had those little bitty ear bones. Like I mentioned them when we talked about the temporal bone way back in the bone unit. And you had three ear bones called the malleus, the incus, and the stapes. And I've got a blown-up picture of that in just a minute. And those are the bones. They vibrate against each other to help bring the sound from the outside and take it into the inside of the ear. You also have what's called the, three different words. You can call it the auditory tube. It's also called the eustachian tube, and it's also called this tube here. It's also called the I have to say it slower, I can't spell it. Tube. Pharyngotympanic tube. And so, or pharyngotympanic. I have a hard time saying it. I like eustachian. That's the one I learned. That's the one I know. So, but it kind of makes sense where they got the word from. You have your pharynx back here in the back of your throat, your tympanic membrane. It's basically a tube that connects those two. And this is when you have to clear your ears. You hold your nose and blow. You're basically kind of equalizing that pressure back there. So that's your eustachian tube. And again, I'll try to have all three choices. I'll have auditory tube, eustachian tube, and pharyngotympanic tube there as well. Like I said, I'm just going to call it eustachian. I can say that. All right, so let's move on to the next, the inside, so you can see the inside of the ear. So this is the middle ear where you've got your 3 ossicles. Why am I going forward here? I don't know. So you have your 3 ossicles here, and I've got another picture I'll show you in just a minute. But this is the malleus, the incus, and the stapes here. So this is your tympanic membrane. Here's your external auditory meatus, and here's your eustachian tube. And so the sound's going to come through here, hit the tympanic membrane, cause these little bones to wiggle, and then they're going to basically take the sound into this area. And so once you get through this bone here, this is your inner ear. So this would be your middle ear, this would be your outer ear, and then once you get past this bone, this is the inner ear. And so what we're looking for is called the cochlea, which is this snail shell looking area. You have this little round opening, or round chamber, which is called the vestibule. Think about if you go into a church, and the entryway into a church is called the vestibule. So this is basically the entryway. Then you have these 3 semicircular canals. Now I think I have a better picture of that. Let me see. Yeah, I do. Okay, so here's your tympanic membrane. Here are your 3 ossicles. So this is going to be the malleus. This is going to be the incus. This is going to be the stapes. So malleus, like hammer, or like a drum mallet. Looks kind of like a drum mallet. Incus means anvil, and then the stapes looks like a stirrup. Stapes means stirrup, like on a horse saddle. And so basically these just kind of vibrate against this, what's called an oval window on the vestibule. So this is your vestibule, and this is your cochlea. So sound waves come through here, and then they're basically transduced into this cochlea, into that spiral organ of Corti that hopefully you've learned about in your lecture videos. And then the information travels through the cochlear nerve into the brain. So all this is related to hearing. So all these are structures of hearing. Yes, these structures here, these semicircular canals, have to do with equilibrium. And so there's basically fluid inside these semicircular canals, so as you bend your head back and forth, the fluid moves and allows you to kind of know where you are in space. There's also an area inside the vestibule that also has to do with equilibrium, and it's more about if you're spinning round and round, like if you're like an ice skater going round and round, that's going on in the vestibule. So you have equilibrium going on in the semicircular canals and part of the vestibule. You have an oval window and a round window. The oval window is right where the stapes meets the vestibule. I don't have a good picture of the round window. I couldn't find one. It's so small in the model you can't really see it. So you can see it on the diagram. I'm not going to ask you because I couldn't find a good picture of it, so you can just not worry about it. But there's a window. It's perfectly round. It's called the round window. One more thing, if you look at this picture, so all the information that's coming from the vestibule is going to go into the vestibular nerve, and so then you put those 2 together and you call it the vestibular cochlear nerve, which is one of the cranial nerves that hopefully you have learned about. Alright, so that's hearing and equilibrium. The next thing is smell, and that's a special sense. And so this is a cross-section looking at a sagittal cut of the nose, so airflow is going to come in here. If you think back to the bone, you have those little turbinate bones, and so you have these little swellings, these little folds inside your nose, which causes the air to swirl around and warm up and get moisturized. Well, warm, moist air allows you to dissolve the chemicals in there, because smelling is a chemical sense, also called olfaction. So those chemicals are broken down, and they can bind to these nerves here. So think back. We had this ethmoid bone, we had that cribriform plate, remember? Inside the ethmoid bone, it had little bitty holes in it. So here's the olfactory bulb of the olfactory nerve, one of your cranial nerves, and it has little fingers, little nerve endings that come down, and so little chemicals will bind there and send their smell up to your brain. And so that's basically what's going on there. So you have your nose, you have your olfactory bulb, your olfactory nerve, Remember, these are called the nasal conchae, and their job is to basically swirl the air to warm it and moisturize it, to dissolve the odorants so that they can bind to the nerve endings and you can smell. And you may have noticed that. Go outside on a really, really cold, dry day, you don't really smell anything. But you go in the, like say, go in the woods. And so, but they go in those same woods on a hot July day when it's really humid and really warm, it's going to smell a whole lot different. So warm, moist air has a lot more odor than that cold, dry air. All right, and then last but not least, we've got vision. And there's a whole bunch of structures on the eye, but we've just limited it to just a few things that you need to know as far as the lab portion goes. Basically, you have your eyeball, and so, you know, the whole thing is your eyeball. It's pretty easy. You have the sclera. So the sclera is the white part. So the white of your eye is called the sclera. The iris is the colored part. So this here, the part when you look at somebody's eye, the colored part is the iris. The cornea is the clear covering, it kind of connects to the sclera, the clear covering over the iris. You have some fluid between the cornea and the iris, that's where the aqueous humor is, and then behind the iris you have your lens. And the lens is part of the mechanism of focusing the light in the image onto your retina. You have the retina, which on this picture is this yellow lining here, so inside the eye is the retina. And the inside of your eye is filled with fluid, and that's called the vitreous humor, so that's what this little shadowy looking stuff is. You also have the optic disc, which is your blind spot. It's basically where the retina and the optic nerve come together, and this is your optic nerve, which again is one of your cranial nerves you need to know about. Let me go forward. If you're looking at the eye, we'll kind of go over it again. So here's your sclera. The cornea you can't see, it's clear, but it's over the iris. And here's your pupil. Here's again the sclera, the cornea covering the lens and the iris. And then here's your lacrimal gland, and that's your tear gland. And they're going to be on the lateral side of your eye. So your tear glands are going to be up here, and they're going to make tears, and they're going to fall and wash over your eye and then drain to that nasal lacrimal duct that you learned about in the bone section. So that's your lacrimal gland. And then the last thing, I don't have a picture of rods and cones, so I probably won't ask it on a lab test unless I ask it as some kind of, it'd be more like a lecture question. But just remember, rods are for black-white vision, or night vision, and cones, C for color, are your color, or bright daylight vision. So you just need to know when to use rods and when to use cones. Again, this is just another cross-section of an eye. So you have your sclera, your cornea, your iris, your pupil. Behind the pupil, that's going to be your lens. Here's your optic nerve. And then, of course, the whole thing is the eyeball. So, again, there's not a whole lot of structures for the special senses, but just a few, just some basic terms, most of which, as you go through life and you go see the ear doctor or the eye doctor, they'll use these terms. They'll talk about your tympanic membrane or your cornea or your lens or your retina. So now you know where they are and starting to learn what they do. All right, guys, give yourself a huge pat on the back. You are now officially done with the lab part of 201. I wish you well. Good luck on your final exam, and good luck in 202. If you have any questions, let me know. Any of the instructors here at Calhoun will be glad to help you. And good luck, and thank you for listening.